Tonight, 13 Investigates has a warning for seniors.
It involves those COVID-19 tests that people on Medicare can supposedly get for free.
Tonight, our senior investigative reporter Bob Siegel shows you the real cost of those tests, who's paying for them, and how fraud could end up costing millions.
It seems like the kind of surprise that's no big deal. 4 packages of COVID tests that unexpectedly showed up in Mike Bowles' mailbox.
I didn't order them. They just came out of nowhere.
Did they want you to pay for these?
No, sir. They said they were free.
A day later, Mike received another 4 boxes of COVID tests.
You didn't order that?
No, I didn't solicit these.
And then, a week after that, when Mike went to his mailbox, you guessed it.
The hits keep happening.
Did you want COVID-19 tests?
No, sir.
Did you ask for the COVID-19
No,
test?
sir.
Do you need the COVID-19 test?
No, sir. Then I'm worried.
He's worried because after receiving 3 shipments of COVID tests in less than a week, Mike is pretty sure something is not right.
I'm a little bit skeptic about anything that's free. Somebody somewhere has to pay for it.
Who is paying for these?
Well, Medicare, you and I are paying for them.
Nancy Moore is director of Indiana's Senior Medicare Patrol, a program that tracks cases of Medicare fraud. And she says getting these test kits when you haven't asked for them is a big red flag.
Medicare does cover 8 test kits per month, but you're not supposed to get them unsolicited.
Is this widespread?
Yes, every state has a Senior Medicare Patrol, and we're all seeing upticks in this kind of fraud.
Why is it happening? Well, in just a few days, the U.S. government's COVID-19 public health emergency will expire. That means after May 11th, Medicare will no longer pay for in-home COVID-19 tests. So some companies that make money by signing up seniors to accept test kits are trying to cash in while they still can. How much do they get? Medicare paid out $94.08 for each of the 3 shipments Mike received, according to his Medicare account.
Almost $300 for products you don't want or need.
Yes, sir.
13 Investigates tracked down the service providers listed on Mike's Medicare statements. I asked them for evidence that Mike actually ordered these tests, and none of them could provide that. One of the companies is in this medical office near Detroit, another in that storefront near Chicago. The third is listed at this house outside Los Angeles, and I spoke to the nurse who lives there.
Yeah, it's shocking to me. It's unbelievable that my home address is being used and my name is being used as a service provider.
Mary Tahiri says she hasn't sent COVID tests like these to anyone. She told me a medical marketing company in Florida is fraudulently using her name and address to bill Medicare without her permission.
Did you have anything to do with these COVID tests being sent to Mr. Bowles?
Absolutely not. I don't even know who Mr. Bowles is, but I'm really, really grateful that he's reporting this. There's so much fraud apparently going on, especially with our seniors. It's heartbreaking.
And it's frustrating for seniors like Mike. Look at this. Mike just got a 4th shipment of COVID tests he didn't ask for.
What are you going to do with all these tests?
Nothing.
Mike called Medicare to report all these tests showing up in his mailbox. And that's exactly what Medicare says you should do if you get test kits that you never asked for.
They need to report it so we can make sure that these bad actors, get taken down.
Because of this report, several of the companies that sent COVID tests to Mike told 13 Investigates they will send a refund to Medicare. Investigators have already detected more than $8.4 million in fraudulent claims for unwanted COVID tests. But taxpayers could also be footing the bill for millions more.
So, Bob, what can we do? What can be done about this wasteful spending?
Well, there are steps that you can take. Actually, if you have Medicare, check your online account to make sure there are no suspicious claims for things you don't recognize. And if there are, or if you receive medical products or devices you didn't ask for, call Medicare or the state's Senior Medicare Patrol to report it. We have those contact numbers posted right now at WTHR.com.
That's good advice. Bob Siegel tonight. Thanks.